Well, Obama promised bipartisanship, and it looks like he's got it. We have bipartisan opposition to this plan. It amazes me that there's so many good questions here, and you brought up a lot of good points. We need to keep journalists accountable too. They're not asking these tough questions. You know, I think it's also a great idea they brought up having them going to your doctors and talking to them about it and asking them. But it's amazing, we have Massachusetts as an example. They just passed a plan, it's failing already. Tennessee, Hawaii. No one's asking. You never see the ask Medicare, failing. They can't solve Medicare, but yet they want to solve the entire system or put us all in this sort of system. So the question I have is related, probably a little bit more boring questions, related to the talk of the government option. And the idea that, well, it's going to be, you know, it's just a choice, competing. Kind of like public education, it's just a choice. You're regular public school, you have so much choice without going to. And there's also talk about the fact that for those who, there may be a mandate, but for those who can't afford it, the government is going to provide financial assistance or subsidy. What I want to know is, for those who can't afford it and get a financial subsidy, are they going to have an option to choose any plan, or are they only going to be able to use their subsidies in the government? If anyone knows the answer to that.
Yeah, basically they'll be in the public plan or they'll be on Medicaid. The one thing that we haven't discussed this evening is the cost of this program, the cost of HR 3200. Folks, if everything on the table comes true, all the tax increases, it will be the largest tax increase in the history of the United States. And it will not only be the rich, it'll be middle class. Make no doubts about that.
Any figures? Numbers?
No, I don't have specific numbers, but
Over 2?
well, yeah,
I really it's 1.5.
The whole cost of it is somewhere between 1.1 and 1.7 trillion. But actually, that's from the Congressional Budget Office. There's some speculation it may actually be 2 to 3 times that. So we're talking about between $4 and $5 trillion.
And if you just divide the numbers out, it comes out to $65,000. It's going to cost $65,000 per person for each uninsured person. You know, I'd rather just hand them over.
By the way, one part of your question about whether these people have a public option or they need to choose with policy, it's my understanding, I read the bill, part of the bill I read that was referred to by a listener, as of the date of the adoption of this bill, private insurance companies are no longer able to enroll new people. So what happens is if you get fired or laid off, and you lose your employer plan, your choice is public option. Your choice is not to keep what you have. So the president is telling us the truth that you can keep what you have, but if you lose it, you can never go back to it. And since your insurance is tied to your employer, your job, you know, we change jobs throughout our life. Our generation changes jobs more than any other generation. Everyone's going to wind up within 20 years of public option. And they told us their goal was single payer within 10 to 15 years. Believe it, they know what they're doing. Believe it. Yeah, the comments? Okay. Here.
I have a couple of things to say. I've been a nurse for 31 years, and I have seen how our doctors work, the hours they work, the times they're not with their families, and I want to thank you for what you're doing. And I really was excited about what you said with those doctors coming together, and I think that's what doctors need to do is take control, because I would love to support that. The other thing is, Catherine, what you were saying about having choices of insurance. And I'm a volunteer in a new grassroots. I am so excited about it. It started off just on August 8th. We got 105,000 new people signing on for last night. It's called WeThePeopleHealth.com. It's starting a grassroots coalition of insurance buying group of American citizens. This is exactly what Congress has that they're not offering us. It's having HSAs choices and having bidders come in from the insurance companies. And I encourage everyone to please sign up. We're trying to get 1 million people to sign up by September 12th. We want to have an impact on Congress. It's WeThePeopleHealth.com. And we need to everybody just needs to take control. And I think the doctors need to come together and not just sit down and take
There's
it.
another model that some of you may know about, are Christian health sharing ministries. Is anyone here familiar with that? It goes back to the idea of folks who come together, they're Christian sharing ministries. They come together, they pay a little bit a month, but when one member needs a little bit more, then they pull out of their pocket. It's not insurance, but they are taking care of each other. And this is a reality for them that's working. Now, under this plan, those would be gone. They had to go to the state of Massachusetts when Massachusetts passed and get a waiver to continue to exist. But that's people who are taking care of themselves with creative options.
That's my question. The one was poll numbers dropping so rapidly from like 65 down to like 42, not so many talking poll. And so many people kind of turning against the administration. What do they have to gain by just, losing so much support if they can stop momentum and let it slow down? They would definitely gain more support to kind of negotiate. They're so extreme. There must be a huge payoff for them getting a better voting block in order to subsidize the voting block they're going to move to the independents.
Well, yeah, the question is with the declining poll numbers President Obama has, the more they push this, the further down it goes, what advantage they have to push it and pass it when it's really a polling disaster, public opinion disaster for them. Is that, in essence, what it is?
Yeah, and that's a really good point. And what is happening is, as the American public becomes aware of what this actually means for us, the polling numbers are going down. 12 weeks ago, 55% favored major government reform, 45% of people opposed. And over the last 10 to 12 weeks, we've actually seen those numbers shift. So 55% of people oppose government health reform now, 45% favor. The longer this goes, the more people understand what's happening, and this slows the entire momentum down. And the whole context of the argument now in Washington, D.C. has shifted. A couple of weeks ago it was bad doctors, now it's bad insurance companies. Man, when they start changing the arguments, folks, they're losing the battle.
There is a pledge to read the bills, and we've been pushing for the members of Congress to sign the pledge, for or against, read the bill. We don't want to repeat of the cap and trade. And also that pledge requires that the bill, the final version of the bill, actually be posted for 72 hours so that the public can look at it before they vote on it. I don't care where you stand on this, if you're on the fence or if you're against it or for it, that is a reasonable request from our